So in the UK, the current situation is that we're finding really quite high levels of prevalence in the dairy herd particularly. Commonly between 60 and 80% of herds are seropositive or PCR positive for Coxiella burnetii. So this is a really significant level and raising awareness for that's important. The impact of Q fever is perhaps more complicated and is bigger than I think farmers and vets appreciate, because maybe they think about abortion, but actually we've got concerns that the role of Coxiella burnetii in pregnancy loss, but also in stillbirths, in endometritis, are also really significant. So we see a big impact because of reproductive failure in our herds. It's really important that as a vet that we have things that we can offer for control to our farmers, and it's really important that we can take the opportunity with vaccination to take a long-term view on control. So we can reduce shedding, we can reduce the level of contamination in the environment, and therefore we can improve both performance but also improve the levels of welfare on these herds too. So we see vaccination as being a really important long-term strategy to control Q fever in these farms. We see reproductive problems and infertility are very multifactorial in cattle herds, and it's easy for us to accept we don't know the answer to a problem, and actually further investigation is really important now that we've got new tools like vaccination that we can use. Approaching a farm with Q fever is firstly about trying to establish some key information, so investigation. We need to do some diagnostics because I think it's important we've got an evidence base for where Q fever might fit with other causes of either reproductive failure or infectious disease. First thing we do is try and establish whether Q fever is present with a Q test, basically a bulk tank milk test, which stabilises on the card, and it works very well. We can also investigate kind of small cohorts, so we can look at serology in groups of animals that may have had reproductive failure, but also we can investigate specific examples, abortions, pregnancy loss, stillbirths, looking at swabs for PCR. So we're trying to combine, I think, an approach which looks at a number of different diagnostics to get a picture. In the same way that we should maybe understand herd status about Salmonella Dublin or around leptospirosis, I think we should understand the herd status, and then that allows us to give good advice and establish good hygiene protocols around calving. So I think with Q fever it's one of that group where we should understand the herd status and then advise, particularly around calving time, hygiene, what appropriate training is for the farm and for the veterinary team as well.